coats. And so I want to start off by saying we really do appreciate you all being here, especially on, for South Africans, a real chilly winter evening. It is quite cold for us, but I know that you all have come out in the cold to support us, to listen to this very prominent speaker a little bit later. A warm word of welcome to you all. It's really wonderful having you here with us. Let me introduce some of the colleagues in the room here. Let me start off by Professor Marwala. Professor Marwala is, for those that don't know, he's one of our Deputy Vice-Chancellors, but I think he's also the Deputy Vice-Chancellor with the longest lists of portfolios. So normally when we've elaborated on all of the portfolios, you've got to have a break for some air, because it's research, internationalization, as well as library information services. Quite a comprehensive portfolio there. But a special word of welcome for the delegation from the University of Hong Kong. And just before I introduce them, those of you that's followed the release of the QS rankings today would know that the colleagues, the University of Hong Kong, the QS ranking system today, ranked at number 26 in the world. Let's give them a round of applause. Wonderful achievement. Our guest speaker, Professor KAO, is going to be introduced a little bit later. And on my left here, Professor Collins, you just raised it, colleagues can see you, and Dr. Tesfaye, also from the university. Warm word of welcome to you all. It's wonderful having you here with us. Also, let me acknowledge Professor Sina, Dean of the Faculty of Engineering and the Built Environment, Dr. Mekwe, who is our Executive Director for our internationalization, who is co-host here tonight together with the Faculty of Health Sciences. Let me not forget the Faculty of Health Sciences as a co-host here as well. It's a very important message I've got to get across as well. But also the Dean of the Faculty of Management, Professor Van Lille, very important guest. We've got the Chair of Convocation here, Mr. Makonto. It's wonderful having you. We really appreciate your support here tonight. Vice Deans, a number of Vice Deans, colleagues from other universities, other research institutions. I see a number of students here from various research centers, and I see they smile when I look at them. So it's very important that we also acknowledge them. It's going to be a wonderful opportunity for you as well. Distinguished guests, ladies and gentlemen. The University of Johannesburg has been running public lectures over quite a period of time. And these public lectures has got more than one important role to fulfill. First of all, very importantly, it's to showcase important international scholars and their knowledge base, such as we will have here tonight. But the second very important aspect, it's also the distribution of knowledge to broader society. And one of the things that we spoke today is that the importance of distributing knowledge, and it's one of the key drivers of your university as well. So many of these public lectures and other discussion groups, debates, and a range of other issues is also open to the general public. Because one of our key drives is to understand that the university is a place of public discourse, and the communities, other people should feel free to come and join in the discussions as we are going to have tonight. So it's a wonderful opportunity to extend the word of welcome to you all here. We really look forward to a wonderful speaker that we're going to enjoy a little bit later. But please let me call on another distinguished scholar, also alumnus from Case Western Reserve University, as our speaker is as well, just to say a few words of welcome on behalf of the university and introduce our speaker. He's really very keen to get you in a speech, so let me just get away here.
Good evening. Sanibonani. Goeienacht. Ni hao. It is indeed a great pleasure for me to welcome all of you here, and in particular our guest from the University of Hong Kong. There is an African expression that says that far is where you do not know anyone. If you know someone, the distance is no longer material. I had the privilege of visiting the University of Hong Kong. In fact, quite a great deal of our staff actually visited the University of Hong Kong. So it is really a great pleasure to welcome you at the University of Johannesburg. I also would like to acknowledge the presence of our deans who have taken time to come and listen to the talk. And some of the deans are not even coming from the sciences. Professor Van Lille.
I had chemistry one
But you know, learning has no boundaries. And it's always good when we attract people who are from outside the discipline so that they can understand advances that are happening in the field. I see the Dean of the Faculty of Engineering, obviously the Dean of the Faculty of Health Sciences, and I see also Vice Deans and Heads of Departments who have taken time to attend this. The President of the Convocation also has taken time to come and listen to this very important talk. So we are looking forward to listening and learning and also taking this as a lesson to move forward with all our aspects of our work. It is indeed a great pleasure to introduce Professor John KAO. Before joining HKU as Vice President and Pro-Vice Chancellor Global, he was a Villas Distinguished Achievement Professor of Pharmacy, Surgery, and Biomedical Engineering at the University of Wisconsin in Madison. He also served as the Associate Dean of the Division of International Studies and an Executive Director of the Institute of Clinical and Translational Research, a consortium based at the University of Wisconsin and Madison of multiple campus partners and research-intensive universities in the Midwest. Professor KAO studied biomedical engineering at the Johns Hopkins University, a Bachelor's of Science. He went and completed a master's and doctorate from Case Western Reserve University. Of course, that's where I did my undergraduate qualification. In fact, when he was there, I was also there. He completed his degree in 1996. I completed my undergraduate degree in 1995. So he was clearly ahead of me. He subsequently worked at Caltech and ETH Zurich prior to joining the faculty of the University of Wisconsin Medicine. ETH Zurich, that's where Einstein actually studied. And that was more than 100 years ago. You know, it's quite an old university. He also holds an adjunct professorship at Zhejiang University. As you know, Zhejiang University is actually quite a famous university in China. We have a professor who did a PhD at Zhejiang University, Professor Wang. Unfortunately, he's not here today. He's in China for few months. Professor KAO's research focuses on development of therapeutics for cancer and wound healing. If I had to go through his CV, we are going to be here for a very, very long time. So I'm going to abbreviate it and request you to join me in welcoming Professor KAO to the stage.
Well, thank you everybody for coming here at the kind of the end of the day on a cold winter evening. So we feel so honored and privileged and felt so welcome to be here. And we had a very vigorous discussion today and trying to figure out exactly how our institutions can work closer going forward. And if I reflect on what I learned in this little short trip, I must say that what defines a great university, particularly a public university, is not just the research, nor the teaching, but the core values, what the university stands for. I think both Hong Kong and South Africa has gone through tremendous transformation in the recent decades, and universities have the obligation to provide the support, the moral compass, and the ability to lift the society to an even higher ground. And it is because of that I feel that between HKU and UJ, we have a lot of commonality on not just our past, but how we view the future and how we want to work together going forward. So I'm very excited, and we feel very welcome. I think the little delegation that we have is the first ever HKU institutional delegation to South Africa and to Africa to that effect. So we feel very honored to share the next few hours with you, talking about translational medicine. So again, truly appreciate the time that you afford us, and hopefully this conversation is the first of many, and we already have ideas how we want to continue this collaboration. So let me just jump right in. I don't know if I wasn't sure if a lot of you have, or some of you, Hong Kong is right there. It's in a very dynamic region of the world. We're part of China, but at the same time, we have a very kind of a complicated history. But geographically, we are well positioned, and we're a public university, like I said, 10 faculties, all 10 are ranked in the top 40 of the world. And that we are very international in terms of our professorial staff and our student intake, and we're very proud of our tradition, but we also want to look forward. So to give you some idea, and thank you for acknowledging our latest QS, ranking isn't everything. We do not drive university development to pursue rankings, but ranking does give us some indicator of exactly where we stand and exactly what we can do to serve the greater public goods. So all these are very important to us. And you might wonder, if HKU is so global, according to some ranking agencies, why are we aspire to be more international? And it is because we firmly believe that to be more interconnected with friends and colleagues and around the world, diversity drives innovation. It's at that interface, whether it's disciplinary or nationalities or ethnicity, even though it could be uncomfortable at the beginning, this is where creative thoughts and creative ideas are generated. So we feel that is absolutely critical for universities to pursue that. And it also leads to better research, and there's a lot of evidence to support that, better teachers and better students, and prepare them better for the future world. So all these reasons compel us to come here, and we welcome you to come and visit us, and so we can be partners going forward. So, but that's enough commercial for HKU. I think you want to come and hear something about translational medicine, so I better deliver. So let me switch my hat to my research life. But before I dive into the topic, I think it's always very important to answer the question, why? Why are we interested in this topic? Why did I choose this topic to devote a good 20-some years of my life and my students' life too? It's when you think about wounds and when you think about implants and all the advances in pharmacological therapies or medical device therapies, you basically are putting a foreign entity into the body, whether it's a very short duration, like a contact lens for a few hours, or artificial hearts or prosthetics that can hopefully last for the entire duration of a patient's lifetime. These are foreign entities, and because of their presence, it elicits this wide range of activities from the onset of injuries to bleeding events to inflammations and granulations, gradually going towards healing process. And under normal conditions, these systems progress without too much problem. I mean, when you have a paper cut, you say something that I should not repeat because it's not pleasant. But ultimately, you don't think about it because the body just heals itself. But the story is different when you have artificial implants or even a tooth filling, because these are foreign entities, and that the intensities and the duration of these activities can affect how the materials or the biomedical interventions then take effect. So I was very interested in this topic of wound healing. We wanted to understand more about this. So we understand that in the microenvironment, it is very complex. You have different cell types. I don't know if I can use my laser, but you have different cell types interacting with each other, and it's a very dynamic process. All these cells release variety of potpourris of proteins and cytokines to regulate each other. So it's hierarchical because things are happening at the molecular level, at the cellular level, at the tissue level. It's also multi-component and very highly dynamic. So then you think of this as a biomedical engineer and say, okay, we understand the biology, but ultimately we want to apply this knowledge for a purpose, for an application. So how do you turn basic biology and physiology into a engineering tool? And this is the area where drug delivery and regenerative medicine come in place. So basically, the idea is we understand the complexity of the environment. Are there ways that we could deliver some of these molecules or cells as therapeutic agents to drive these processes to an outcome that is favorable, a better healing, for example, for patients, or more biocompatible devices, so these implants last a lot longer. So you basically then need an enabler to do that, and biomaterials at the Case Western, it becomes an obvious choice because there are different ways we could influence this microenvironment. So my talk is basically will be in two parts: the R part, the research part, and the D part, or the development part, the R&D part of a basic science research. So at the beginning, I focus on the basic science. So we developed this platform technology called interpenetrating network. So it's basically a mimic of the cellular microenvironment or the extracellular matrix. So the whole idea is that it contains two components, and it contains a synthetic component shown here in red. That's polyethylene glycol. And then there's a biological component, supposedly that should be in orange, that is a biomolecule derivative. And we came to this formulation because trial and errors and based on learning from biology. And we perform chemistry modification on these entities so they can be manipulated. And then the idea is that it creates an artificial microenvironment. Then we can encapsulate different kind of drugs, from small molecules to proteins or to cytokines, and we can incorporate cells as both different components to influence the tissue that we want to influence. So it becomes a multifunctional network based on some of the basic principles of tissue and biology. But then the materials are then designed to serve different both mechanical functions as well as biological functions, and then we spend a lot of years trying to characterize this material. So all these are relatively basic science research. To give you some idea, by varying the formulations, whether it's the polymer ratios or the molecular weights, we could have a wide range of mechanical properties from 1 to 350 megapascals of Young's modulus for elasticity, to degradation rates, and so on and so forth. So this gives us a wide menu of options when we think about applications. So again, is understanding biology to come up with an enabler for ultimate application end. So these mechanical properties are critical for applications in terms of tissue compliance, degradations, and so on and so forth. And we also want to make sure that the materials, once it's formed, form a very intimate contact with the tissue bed, because ultimately we want to influence the biology. It cannot be at a distance. It has to be really close and personal. So we have a range of adhesion. I just wondering, has anybody? I don't know the name in South Africa, but they sell these super glues that are very, very sticky. And I don't know if you use super glue, but don't get it on your finger. Or if you get it on your finger, it's really hard to pull it off, right? I saw people nodding. I mean, I have a lot of experience with super glue. So just in case if it happens to you, in case you get super glue on your fingers and you try to pull it off, it takes about 5.6 Newton of force, just to give you an idea. So you have to apply 5.6 Newton of force to pull it off. Do not do this at home, and it's just an experiment. But our material takes about 3 Newton of force to peel from the skin once it's formed. So it's on there pretty tight. And that's very critical because if you want to deliver cells and drugs, you need that intimate contact. So we thought that's very critical for the application. And degradation rates give us a wide range of the amount of time it takes for complete degradation. So you think about implants, whether it's for short-term application or long-term applications, again, this opens up the platform for different types of modifications. And we looked at different delivery. We published more than 80 papers on looking at this material function relationship and how it's applied to deliver drugs and so on and so forth. So we felt, well, after so many years, we have a good handle on this thing. So we started to entrap therapeutic cells within the matrix, like mesenchymal stem cells, that can be differentiated into different lineages, and we found that we are able to incorporate live cells within this matrix, and that upon different stimulations, they can differentiate into adipocytes or chondrocytes or osteoblasts, even in the presence of inflammatory cells such as white blood cells. So even in the presence of a natural defense mechanism, the therapeutic cells maintain their functions, and we felt very excited about that. And then we did, so this slide represents 2 PhD theses. So we looked into exactly what is that interaction between the matrix, the cells, the white blood cells, and how they modulate each other. So by this time, we felt that we have a basic understanding of the materials and its ability. So we went and did a small animal and ultimately large animal study. So we created we use a model called partial thickness wounds. So in the medical area, for example, if you get say a third-degree burn on your face, the gold standard is to harvest the skin from your thigh and put it on your face. That's the best treatment for that. But obviously, when you do that, you might fix one wound, but you created another wound. Okay, so that's the donor side wound. So this model replicates, and pigs are the best. Whatever that's supposed to represent, the pig skin and human skins are the closest. So porcine models are used in this regard. So basically we create, sorry, I have to show some blood, so I hope people don't get squeamish because it's hard to talk about wound healing without actually see some wounds, and I actually think that's pretty important. So imagine the gentlemen in the room, if you ever shave, and then if you cut yourself with a razor, imagine you deliberately scrape the skin off with a razor. So that's what we did. So it's very bloody and not so pleasant. But that's how they harvest skin to application. So to make a long story very short, so we compare our IPM with the other clinical standards. And I don't know how many medical doctors are in the room, but clearly after 3 weeks, you could tell that the outcomes are very different. I mean, they just look different, different colorations, different level of scars and whatnot. And it's all because of the different materials that were used. So early intervention, depending on the methods, will have a long-term effect. And we thought that's very powerful because it demonstrates the material is not just passive, but it can really influence the biology and the physiology underneath. And then we did clinical assessments. We showed that the histochemical analyses and pathohistologies and even the cosmesis, the appearance of the wound is a lot better when we use the IPNs. So we at this stage we thought, well, we're very excited. We know there's clinical needs out there, and perhaps there's a solution. So a typical researchers in a university setting would do these kind of a course of study. You come up with an idea, you do a whole bunch of studies, you publish papers, and now you're trying to find an application. And then later I will address the pros and cons of this push model. You're basically trying to push a technology from inside the university to the outside world. So we were very typical academics trying to make a difference in the world. So we looked around and said, exactly how can this technology be used to address real problems? So we turned into wounds, particularly skin wounds, cutaneous wounds. So according to the US CDC Center for Disease, the cause of trauma-related death in the U.S. is actually two times higher than cancer and cardiovascular diseases combined. So it costs a lot of money to heal wounds, and worldwide it's a major contributor to disability-adjusted years, and then. The crux of it is because the current practice fails more than 50% of the time. So the refractory level is extremely high. So wound healing is really an art, and because the outcome is very hard to predict. I can get into this more if you're curious. So we look at different kind of wounds. I'm sorry, I should give you a disclaimer. Next few slides will be really, I actually went to the hospital and started taking pictures with my collaborators. So close your eyes if you don't want to do it, but I'll let you know when it's all over. So we looked at, well, wound, there are different kind of wounds. So let's educate ourselves and see where we can contribute. Typical trauma surgical wounds. When we go in and get part of your liver removed, these are creating surgical wounds, and these are fairly easy to address. But trauma wounds is very difficult. Wisconsin is a farming state, so we see a lot of farm injuries back in the day. So this farmer got two fingers cut off in one of those big devices, And the problem is that suture normally does the trick, but sometimes these wounds are so complex, and that's not very easy to heal. Another one is chronic wounds. Bear with me, only 2 more slides. And these are what they call English muffin wounds. So basically, when the patient has a hard time healing, you could actually put your hand into this kind of wound, and the patient will have no feeling. And it's really not pleasant for everybody, but these are very, very difficult wounds, not because just the wound, but the underlying pathology of diabetes and cardiovascular dysfunctions and whatnot. And lastly, more complicated wounds like infected wounds, where you have the combination of everything. On top of it, it's infected. So really the way to do this to cure is amputation, and certainly if we can come up with any methods to improve the outcome, that would be ideal. And I do want to point out this 10 to the 4th organism per gram of tissue as a clinical definition of an infection. I'll come back to that number in a bit. So we thought, okay, let's see what happens when we put our IPNs with drugs and antibiotics. So we put in mesenchymal stem cells along with drugs into these IPNs. Oh, so for those who close their eyes, the fun pictures are gone. So it's just boring histograms and plots and green pictures. So we're able to show that that when you incorporate a drug cocktail, there is actually no effect on the function of the therapeutic cells that we put in. So this is the IPN with both cells and drug cocktail together because we want to tackle difficult wounds, both wounds and infection. And then we actually went to animal model and we created infected wounds with 10 to the 4th CFU per mil of the tissue. And then we treated with the IPN. And then clearly when you put the last part, when you put both the drugs and the therapeutic cells, there's an increase in how fast the wound heals. So we found that very encouraging, and the healing looks very normal. So I won't get into the histology and that there's a lot of epithelial growth after 7 days post injury, and that we saw a dramatic reduction in the infected colony. S. epidermidis is a pathogen of choice. So from 4, we dropped it down to less than 0.5. So in essence, it's no longer infected. So then we got really excited and said, well, what's next? And all these are resulted in published papers, but we want to translate. And so I really have to acknowledge my collaborators, all the support that got offered to me at Wisconsin. So then we need to kind of switch gear and look at the larger ecosystem of how to get research from research into a product, particularly in the biomedical or the life sciences space. So the state of things globally in this translation from basic to apply is there's no short of ideas. There are plenty of smart people everywhere. Here, Hong Kong, everywhere. So people are always coming up with the next best thing. A university like HKU, I'm sure UJ, we have patents that just kind of sit there because it's really hard to license. And Wisconsin is one of the earliest university that set up a tech transfer office more than 80 years ago with more than $2 billion in endowment. And they're finding difficult to license technology. And then as a researcher, I don't appreciate that because I thought, well, I cure all these things, so people should be knocking down my door and wanting to buy these IPNs, and why aren't they coming? And what am I missing in the picture? It is because I learned this phrase called Valley of Death. I just wonder how many of you have heard this expression, Valley of Death. It just sounds so deadly. And it just sounds like, how am I going to cross this Valley of Death? And first of all, what is it? So Valley of Death is really a sector coinage in biomedical space, whether it's drug, or devices, or contact lenses. I mean, anything that's related to medical. So Valley of Death basically means to get a technology from discovery, basically university, to a product. It takes about 14 years at a cost of more than $2 billion. In Hong Kong, there's a lot of horse racing. And at the odd of 1 out of 10,000. So 1 out of 10,000 technologies. I mean, university doesn't even have 10,000 patents. But anyway, so it takes that much time. So clearly, this is very risky, very expensive. No single entity, doesn't matter if you're Harvard, MIT, or HKU, or even pharma can have this appetite. And that's not even considering the product is selling money. Just getting to the market takes that long. So you see drugs pulling off clinical trials, not because because of a variety of reasons, but it's just very, very difficult. So I was very discouraged, need to say, and I said, how am I ever going to cross this valley of death? And then we have to kind of reflect, why is it so difficult? And because there are basic science reasons, as well as universities are just not designed to address some of this commercialization requirements, everything from regulatory, value proposition, quality systems, business plan, scale up. I mean, I have a lab of 10 people. There's no way I could do all of this. Or there has to be a different plan. There has to be a kind of a transformation in terms of how we think about translational medicine and driving impact. I was able to convince the higher powers at UW-Madison to kind of use the IPN as a guinea pig to see if we can come up with a new paradigm. So we set up a project to look at some of the developmental requirements of the technology so it can be well positioned for commercialization. Everything from design history file, packaging, sterilization method, manufacturing methodologies, and first-in-man protocols. So none of this will result in published paper, but these are absolutely required if you want to translate life science or medical science or technology into the market, or at least for investors to even answer your email. So without getting into detail, we work with a bunch of people. We had a team and to develop quality systems. So these are all very project management type of lingo. Different phases, different design, implementation, commercialization, and every step has a very clear Gantt chart. I'm an engineer, so I love Gantt chart. It just means that for a particular item, you have a point person, you have exact timing, and then everything is benchmarked. Okay, none of this will result in published paper, but you have to do it this way if you want to do the big D or the big development. And then this slide represents basically 4 years of my life at Wisconsin, aligning different partners, whether it is university units or outside parties like pharma or angels or VCs, and to set up this ecosystem to do drug and device development. And leveraging the resources that's already there. So we did not build anything. It's not a bricks and mortar type of investment. It's all about alignment. So we talk to different resource areas along the development path from animal modeling to imaging to pharmaceutics, and then create this massive team that we can shuttle project down the development path. So to make a long story short, after all this, we end up with a bag with 2 containers. And when I saw this, I have 2 kids, and it's almost like it's harder to do this than to kind of, I think I won't get into detail, but, it's, you see, okay, you get a vial and a bucket in an aluminum foil bag. That's really the product, okay? And we were so excited. There a lot of champagne corks opened that day. And then it's licensed by Merck and Sigma, and the product line they launched this year. So the story is that it takes a village to raise a child, as the saying goes, and it takes a village to translate a technology from a small lab into the market, and involves a lot of people. And I just want to acknowledge them, even though they probably, I don't know, maybe they'll see this talk. My students, my clinical collaborators in medicine and public health and the hospitals, the surgeons, and then I had a startup companies, the entrepreneurs, the VCs, and then the tech transfer office, and then my commercial partners, Sigma, Merck, everything. Their global technology collaboration team, their legal and licensing team, the packaging team is pretty interesting. I mean, it took us a month, but they figured out the best way to package this in a box. So they actually had a guy who figured out how to package this, and his job is to drop the box any way he could imagine. And it has to withstand, dropping it from the second floor, dropping it at an angle, sitting on it. I mean, even people like that, without which this would not be possible. And I think this really takes that teamwork and the different companies I work with. It's just and the funding agencies who kind of bless me along the way. I get really touched when I show this slide. So the conclusion is that I still believe we have a right platform to help with not just basic science understanding of things, but to apply in the real world. And that academia, we cannot operate in silos. We have to be proactive. We have to challenge our thinking. We have to be innovative and to work at that very uncomfortable interface, whether it's with industries, or discipline that's not familiar to you, because it does take that village to make it all possible. And that I only show you the successes. There's been plenty of bruises along the way. I mean, I'm covered in them. There are a lot of do's and don'ts. And so we're replicating some of these models in Hong Kong U. We recently launched a translational medicine consortium with regional universities, and hopefully through the Chinese medicine or some other collaboration we can engage to form this teamwork to really move forward. So that's really the science part of things, and then at the end, I do want to just say how much the three of us, and on behalf of the University of Hong Kong, how much we appreciate this past 12 hours to share meals and sit-down meetings with you to talk about what we must do as universities to drive impact, to serve the community. And I think that alignment of core values make us natural partners. So I cannot say enough on that. And then I promised Pinky I would make an announcement, and I'm going to do that. So recently we launched several funding schemes let me just go through this very quickly. Several funding schemes to facilitate, to bring students from different backgrounds to our campus. So this is a full expense paid, full scholarship, including airfare accommodations. Welcome you to think about that. And we also recently launched a visiting scholarship for short-term visit by students, so you could come. We'll pay for airfare and everything, anywhere up to a few weeks on campus, just to get a sense of what we're doing. So all the information is on this website. It's a global portal, basically global.hku.hk. And we also have different schemes for short-term exchanges or short-term visit by professors and students. We have seed funding for initial handshaking events if people don't know if there are potential collaborators. So all these are at your disposal, and I really hope that we can, through these enabling platforms, to bring our institution and bring our cities and bring our regions ever closer together, because I know there's a lot of work to be done. So once again, thank you so much, and sorry about the bloody pictures. So thank you.
Thanks very much. So maybe another round of applause for Professor KAO. So as you know, the program says that this is the time for Q&A. So I will ask some questions, and Professor KAO will evaluate if you have the answers correct. That's one interpretation. Ladies and gentlemen, I'm just joking, of course. Don't worry. This is the time and opportunity for you to ask some questions. I really liked that you have wounds at the end, but you also have a cure. So you've really taken the bench back to the bedside, as you put it in translational medicine. I think it's a very regenerative approach, otherwise also called positive feedback in some disciplines. So questions, Professor Marwala?
Thank you very much for that talk. I see your work requires quite a strong multidisciplinary posture. And I know globally you have biomedical engineering courses, but in South Africa we don't really have biomedical engineering courses. How do you bring all these people who don't necessarily come from a biomedical engineering
Right. So obviously, I only show you the happy endings and the good results, and there's plenty of kind of the hurdles. Doesn't matter if it's biomedical engineering or what other discipline, but I think going forward, interdisciplinary approach is absolutely necessary to tackle major challenges, both regionally and globally. And I think, as I mentioned, one way to come up with creative solution is to become more international and to work more along interdisciplinary interfaces. And from my personal experience, I think the most important part is communication. The kind of the mindset that you set aside your ego, you admit that there's certain things that you just don't know or cannot do, and you reach out. And I would say 85% of the time, you get door slam on your face, or you don't get email reply. But it's that 15%, that small percentage, where the person that you're trying to reach out see the world has the same world perspective, and then you come together, and then you gradually build that team. So maybe I'm kind of romanticizing my own experience, but it does take that persistence and the ability to put aside the ego, and then really get down to what needs to be done. I think that's and it's kind of what we're doing when we're trying to cultivate institutional collaborations, that we have to admit there's certain things that HKU just cannot or doesn't know how to do. We're not positioned to do certain things, and this is the area where then we form natural partnerships. So it's at the personal level as well as at the larger institutional level. Yeah.
All right, some more questions? Yeah.
Right. Yeah. These are great questions. Let me try to kind of answer them all at one go, because they're to me they're somewhat related. So going back to the how do we pick the formulation for a particular indication, and that actually was a very difficult lesson for researchers to learn, because on one hand, you're so excited about your technology, you think, well, it can be used for everything, from infected wounds to diabetic ulcers to trauma. And then you kind of position yourself to do that. But I quickly learned that is a kiss of death when it comes to regulatory. So, like the U.S. Food and Drug Administration or the CFDA in the mainland China, there you have to be very, very specific on the indication of your intervention. So you have to be clear on, well, this is for trauma of a specific type, and then the formulation you picked matches that. So in essence, I had to wear different hats. So when I talk to investors, I have to pitch the technology as a platform. You can do so many things. And right now, we're developing the technology for liver. So that's internal applications for liver when they remove the liver and create the wound. But for regulatory, you have to really get down to specifics. For example, you mentioned wounds that are re-wounded. Those are very complicated, and regulatory normally do not approve those kind of products just because the safety of the patient comes first. And so the wound is not just the wound, you have to consider the individual. Oftentimes, the wound is secondary. So hopefully that kind of answers your question, yeah.
Okay, some more questions, yes?
Good evening. I wanted to ask about the properties of the material that you used. So what qualified it to be biocompatible? And then I also wanted to ask, in terms of the product, who would your market be? Would it be something you could administer over the counter, or would it be a doctor who would have to administer it within a clinical environment? Are there certain like parameters in terms of like conditions that
Right.
have to be stable?
Right.
And then, yeah, and then I just wanted to ask, in terms of the clinical trials, how long did it take?
Oh, yeah. Wow. Okay. These are big questions. So going back to the particular degradation you were asking, and so it's all about the different formulation you can choose. And when we were trying to position this as a product, it wasn't very clear which way we wanted to go, whether it's over the counter or prescription only, because each one will carry different risks. Over the counter, you have no control how the material or the device is being implemented, and it could be but it's easier in terms of regulatory. But the problem is that there's very few predicates products, so you cannot go to say the FDA and say, well, because this company made this product that's somewhat similar to what we're doing, then you could classify this as type 1 or type 2. So eventually we thought the better way to do it is through the professional route. But then it becomes very apparent that you cannot over-engineer a product, because then the end user is really the nurses and the physicians. If what you require them to do doesn't fit their routine point of care, it might be the best thing, but they just won't touch it. I mean, doctors are busy. They're not going to go through months of training so they can use your little IPN on these small number of patients. So easy adaptation. So I spent a lot of time talking with clinicians and what works. There's still hurdles we want to overcome. So we also position this as a research tool, and that's what Sigma was interested as well. Different ways that you can position the product, but instead of just pushing out to the market, you create what's called push and pull model. So you understand what are the needs and what can be pulled versus you just trying to push things out. So those are very probing questions. I think you should really feel good about that. And in terms of clinical trial, we did a first in man. These are small safety trials, because in wound healing it's very hard to demonstrate efficacy because of the underlying diseases and the complex condition of the patient. So almost all wound healing products, they don't guarantee it will work. because the patients are all very different. So one thing they definitely want to show is that it doesn't make the wound worse. So safety is very important. Yeah. So great questions. Yeah.
I don't see. Yeah.
You know, coming from Africa, cost is important.
Yeah, absolutely.
What would the product like this sell over the market, and
Yeah.
how many treatments do you possibly need?
Right. Yeah. That's a topic that I really had a hard time convincing Merck to kind of play fair, and you wonder why drugs cost so much money because of the valley of death. Because to get one product into the market, they have to fail 99,000. So it's not making an excuse for the pharma. They're raking in bazillion dollars, but they should have that social and moral obligation to make things a lot more accessible. So this is an ongoing tension in the pharma and the medical space. How do you make it more accessible? And that so there isn't an easy answer to your very important question. I'm not even going to pretend I have the answers. They're definitely selling it at a price that I think can go down a lot more. Let's put it that way. Yeah. Thank you. Yeah.
Charles and then Elizabeth. Okay.
I just wanted to, well, I'm from engineering, so you can excuse me if I get lost. I think you talked about the atoms and the molecules in the function around tissues and wound healing. I just wonder whether your work extends to genetic engineering and modification and goes more micro in terms of wound healing
Right.
research.
Right.
And whether there's any, I think we talked about concussions or whatever you apply, whether those would be with any kind of cloning involved in the process. And my second question is to do with the valley of death. I think the valley is very scary.
You're not the only one.
Where you think that some investors might actually sink with the valley
Yeah.
if they overcommit funds to research and development.
Yeah, absolutely.
Commercialization. Are there any bad news, bad stories, or any lessons that you can share?
Sure, I'd be happy to. So two things. Genetic modification. I came across the opportunity with a collaborator, and she was developing these genetically modified keratinocytes, and basically they can release natural defense mechanisms to fight off infection. So we collaborated. So the IPM provide a platform to deliver these cells into the wounds. So that's one avenue, and then obviously in terms of an issue in regenerative medicine is not just wound healing, but in general it could be regeneration of the central nervous systems or skeletal systems or whatnot. Is the amount of cells that's needed. It takes a lot of time to expand these cells, so the area of cloning becomes a very important active research area to quickly grow the number of cells. So you could use for a real clinical scenario. So that's kind of the two area I touched on. And in terms of lessons learned, trying to cross a valley of death, it is an issue. There's a study done by the pharma industry. We're now at a deflection point where going forward there will be no more new drugs, just because. It takes too long, it costs too much money. So all the new diseases, like for example, a lot of antibiotic resistance strain, there will be no drugs to treat them. So it's basically a time bomb when you don't have new pipelines. Not that we're short of ideas, but kind of cross this valley of death. So there's that urgency. I think WHO and others, we just recently launched a program in HKU looking at infectious diseases, we hope there's not going to be another SARS, just because it's hard to get new drugs into the field. And if pharma wants to make money the way they want to make money, it's going to be even more difficult. So some of the quick fixes right now, it's called repurposing. So you may have a drug indicated approved for one application, then you can try for another application, and usually that shortens the valley of death and make the risk. So there are different creative way to do it. I think our researchers must know these options. Otherwise, if they just adapt the push model, it's not going to solve the problems we will have in the near future. Yeah. So yeah.
And then the final question from Elizabeth. Thanks.
Thank you very much, Prof. Prof, I assume that the PEG that I saw as a matrix is polyethylene glycol. I'm interested to know whether you have tested the polyethylene succinate, and another interest is whether are you only considering biodegradable polymers? If so, are thermoplastic any area which
Right. Well, okay.
be
Wow.
considered in future, especially when we look at the scalding?
Yeah, wonderful. So succinimide, we created a library of PEG derivatives, and it was very helpful to look at any of these microing reactions to create polymerization to form that cross links. It all boils down to the kinetics of the polymerization, and it wasn't as quick as we would like. So it doesn't mean it doesn't work. And then we also found a very important factor in terms of the molecular weight of the polymer that you use, what we tested, can really affect the kinetics of the reaction. So you know, we actually we filed a patent of 50 different PEG derivatives, and that's one of them. And in terms of thermoplastics, we never explored that, and not because we don't think there's a potential for it. It's just we were targeting soft tissues, biodegradable, hence we use PEG that's already approved by most regulatory agencies, and then the collagen derivatives. So it's more of the practical consideration for the indications that we wanted. But clearly, we could think of different ways of reformulating this platform to incorporate some of these ideas. Yeah, great. Yeah, super. Yeah.
Great. Let's give Professor KAO another round of applause. We have a small gift, and Professor Swart and I would like to call Dr. Mechwe. Last year, Dr. Mechwe got us speaking in November, so I think you should give over the gift on our behalf.
Okay.
Thanks.
Thank you. And can we reciprocate?
No, you have done that before. You have done the job now.
No. We have something for you too. Since we're capturing this on video, I just want to make sure that this gets on the big screen. This is great.
Oh yes, wonderful. Green solution.
Great.
Thank you.
Thank you.
Very much.
Thank you.
We're gonna need to come in. You can have a seat. That's wonderful. Thank you. Thank you once again for that wonderful presentation. Just three quick points before I ask Dr. Sina to extend a vote of thanks and invite you to something to eat and drink. I think there was a number of lessons to be learned here tonight. I think just in summary, 3 important lessons. The last one is for the deans and the executive directors here. The first one is the absolute importance, and especially to our younger researchers in the audience here tonight, is the absolute importance of moving out of our silos into a multidisciplinary notion, because that's really where the success of research lies in future. Working in our silos is not going to get solutions. It's not going to take us forward. I think the second one, and you've so eloquently highlighted by saying I'm so bruised, is the whole notion of resilience. To get this far in any type of work we do, you've got to have resilience. You've got to continue. You've got to persevere. Sometimes there's no funding. Sometimes there's people that don't want to work with you. But you've really got to stick it out and persevere. It's a very important issue. And the last one I want to say to you, Professor, is that this is to my executive directors and deans. You know, we're in the process of starting with our budgeting process. And our DVC is quite tight on new posts. No, the other DVC. But he would have helped us to assist us with this. But I've never heard the context, and I'm really going to try it in my faculty, to motivate for a person that I could use for one more role is to test different boxes in the faculty. And I'm really going to try that with our DVC this year and take that forward. Professor Sina, over to you.
Thanks very much. We do actually have some destructive and non-destructive testing abilities. Some of it is by design and some of it is by coincidence. Ladies and gentlemen, my task is just to thank everybody for being here, and also once again thanks very much Professor John KAO, and also to the KAO Lab. I had the chance to look at your profile and your group of students that are also following you and your trip, and also to Professor Derek Collins and Dr. Faisal Tesfaye for being part of the delegation. And we're interacting over the next I guess 24 hours in trying to seek more collaborations together with the University of Johannesburg. So thanks once more for being from Hong Kong to South Africa. I'd also like to thank Dr. Mechwe. Dr. Mechwe and her team has helped us in getting this together, and she asked me to call you up sometime in November last year, and we finally spoke in Jan. Professor Chiliti Marwala, he's back now. He must have just left during the budget discussion. This is the sixth sense of the DVC. It somehow always works. We at the Faculty of Engineering and the Built Environment partnered in this event with the Faculty of Health Sciences, and thanks very much for the biomedical engineering to help translate that unique component of the relation. So thanks also to Professor Andre Swart, who worked with us on this event. But I think I'd be amiss if I don't thank a number of individuals that worked behind the scenes to getting this event together. Tuli Shabalala from the Faculty of Health Sciences, who's the marketing personnel. Precious Maputle, thanks very much for the role. Also to Percy, who's our new assistant in marketing, who's joined us, and Ismail had to leave since he's fasting and the fast breaks at this time, and for the role that he's played in trying to get this event together. And ladies and gentlemen, and to you, that despite our arrangements for a slightly warmer evening, we couldn't get that totally right. But thanks very much for joining. And if you don't believe in our ability in my and Professor Swart's ability to change the weather, we have something next door in terms of food and some drinks. Apparently with the latter, the weather can change. Ladies and gentlemen, thanks once more, and please join us next week.
Yes, that would be the first time we took those dogs.
Okay, let me ask Professor Swart. Andre, do you want to?
Thank you for assisting.
Andre, here. It's a small token from
Oh,
HKU.
thank you very
Hopefully
much.
we'll
It's much
see you
appreciated.
later
No,
this year.
definitely. I'm just going to introduce you to my two colleagues who complimented me so just now. So thank you very much. Much appreciated. I was just telling my colleagues. You were excellent.
How's the laptop?
Awesome, thank you. I think we should